When dealing with anosognosia or poor insight, the doctor knows best approach does not work because collaboration is a goal. It's not a given, right? If somebody doesn't think they're ill, then they don't care about my advice. And very quickly, before I continue, I need someone to volunteer. You don't have to get up. Preferably somebody who's a mental health provider, actually. Just raise your hand. Okay. Actually, I'm going to pick on him, if that's all right. What's your name? Scott. And just tell me quickly a couple of biographical facts. What do you do? Where do you work? Do you live with other people? You live alone? You have a wedding ring on. Are you married?
Married, 2 children.
What's your wife's name?
Cheryl.
Cheryl, and you have 2 children. Okay. And where do you work? You're the director of the forensic hospital, so you must be a doctor, Scott. Dr. Scott what?
Terry.
Yeah. I feel bad about this. I'm going to call you Scott because I don't want to feed into the delusion. Well, Scotty, I don't want to feed into that delusion either because you're not married to Cheryl. Is Cheryl here today? Yeah, and you know why? You know where I'm going because people have said this to you many times before. Scott, you're not married to Cheryl. You're not a physician. You certainly aren't director of any hospital or a forensic hospital. Okay? All laughing aside, just stop laughing for a minute. Put yourself in his seat. Let's pretend this is really happening. All right? So, Scott, I know you came here to hear me speak. A lot of people here, a lot of people that are very worried about you asked me to do this intervention with you. We're really worried about you. I have documentation I can prove to you. I have orders from magistrates showing, a restraining order, keeping you away, a no trespassing order, keeping you away from Cheryl. You've terrified her and her 2 children. You keep showing up at her house. She's a very kind woman. She doesn't want to press criminal charges, but the only way she's not going to do that is you've got to go to the hospital. And you aren't working at this hospital that you say that you're working at or director of. They, too, have restraining orders. They have judges' orders to keep you off the premises. We're all trying to keep you out of jail. We want you to get help. I've got an ambulance outside right now. We can take you to a doctor. We can take you to a hospital right now and get you some medicine to help you with your thoughts. Okay. Would you do that? Why not? He's shaking his head no. Big surprise. Right? Why not? Why wouldn't you do it? Seriously. But why are you angry? What am I? I'm not getting anything from this. I'm a professional, and I'm concerned about you. And this woman who you believe is your wife is telling me that she doesn't want to send you to jail. I must be. I'm lying to him. I must be doing this to hurt him, or otherwise, why would I be saying this? That's where his thoughts start to go, right? And where might they continue to go? What if you went and called Cheryl right now, and she said, "Sir, I'm not married to you. I know you believe that. You've been terrorizing us. How long have you been married?" One day I'm going to elicit an actual psychotic break in somebody when I do this, and I'm going to jail. I know it. No, when? How long? Sir, you've been doing this for the last 21 years. And it's like you show up and then you disappear for a few years, and it's not a big problem for us. But what if you heard your wife say that? What if are there colleagues in this room from where you work? And what if you talked to them and they said, "Look, we know that you believe that you're the director of our hospital, but you're not." Would you then believe you're mentally ill? What if there was really good proof? I mean, really, you could tell me, "You show me this and I'll believe it." And I'll show you that. Would you really believe it, though? That you're mentally ill, that the last 21 years of your memory and understanding of who you are and who you're married to and the job you have are all the product of chemical chaos in your brain? Would you believe it then? Right. Wonder why and how I put them all up to it. And you're a psychiatrist? You're educated in psychiatry. You know about lack of insight. You know about psychosis. And he's telling us, and I thank you for being honest, because sometimes people will say, oh yeah, no, I think I'd start to think maybe I was mentally ill. I don't believe that. I don't believe any of us would if that happened to us. I think it would really be difficult to really stop believing you are who you are. Right? And we don't think of that when we think of how strongly people hold on to the belief, I'm not sick. We don't think that it's as strongly held a belief as Scott's belief that he's married to who he's married to, that he has 2 children, that he works where he works, that he runs the hospital he runs. It's every bit as strong a belief, as is the delusion, whatever it is. Oftentimes, every bit as strong a belief, strongly held a belief, as his beliefs or any one of your beliefs about who you are. Right? So if we're dealing with somebody in that instance, telling him he's sick is not going to help, is it? If he were in my office, collaboration isn't anywhere nearly, a given. I mean, if he's been forced into my office for some reason, coerced into it, we've got to step back and start from a very different perspective than if he came into my office and said, I've got schizophrenia and I've got depression and I've got these problems and that's why I'm here, right? Then we're collaborating. So we can't expect someone like Scott to be grateful or compliant or receptive, can we? Grateful for the advice I'm going to give him? No, you shouldn't go to the office. No, you shouldn't go to Cheryl's home. What you need to do is go to this partial hospitalization program. And I'd like you to take these medicines. He's not going to be receptive to any of those things, right? Would you? Would anybody here be receptive if this had happened to you? What we can expect, he's going to be frustrated and angry, and he's going to start sneaking around. He's either going to overtly refuse my advice, or he's going to secretly. He's going to cheek the meds. I love that term. It's sad. I mean, I don't know how many of you had to do that with a relative or a patient, but check to see if they've swallowed the pills. It's such a poignant and sad moment because what that person is doing, and if we imagine if Scott were in, let's say Scott was in the hospital now for a month, and he would learn what to say to get out, and he'd be probably very scared and lonely and angry and trying to figure out how to get his life back, and he would probably cheek those meds. I would. Right? I mean, these are the things we can expect. And where you started, this person will be very, very suspicious of us. If you think that you're dealing with something that is as much a symptom of the illness as a delusion or a hallucination, you can't say that the person refuses to acknowledge the illness, right? I was giving a talk once, and this woman stands up, she has a question, and she has my book, and she just says, I just want you to know, I swear by this is really wonderful, thank you for writing it. And I said, well, thank you. And then she says, but it doesn't work. I was like, what? I said, what do you mean it doesn't work? And she says, my son refuses to acknowledge he's mentally ill. And I was like, all right, well, you need to go back and read chapter 3, where we review all this research. Also, in that book, and in the type of communication strategy we're going to talk about after the break, getting the person to understand they're ill is not the goal. You take that goal and you put it high up on a shelf and you lock it behind a door and you leave it alone. This is not about getting someone to admit they're ill. Is he refusing to admit something? No. He can't believe he's suffering from a delusion. He knows what the truth is of his life, or won't admit. What we do say is the person cannot acknowledge, the person is unaware, the person is unable to admit. Well, the usual strategies of reality testing and coercion and waiting for the bottom to be hit don't work with this problem, in my opinion, generally. And I'm going to not even talk about reality testing, because we're going to get into that after the break. But coercion, what happens when you coerce somebody, and I've been a part of this. I've worked with police departments. I've worked inpatient, outpatient. I've worked closely with my brother, is you get the Band-Aid. You get the person's symptoms reduced during that brief hospitalization or crisis intervention. And then when it's all over, they go and do what they want to do anyway, right? So you end up basically putting a Band-Aid on the problem. I'm not saying coercion isn't helpful, and we're going to talk about that. Waiting for the bottom to be hit is very, very dangerous for a million different reasons, not the least of which is the mortality rate in these illnesses. What's the suicide rate just in schizophrenia alone? Does anybody know? It's about 10%, about 1 in 10. About half of everyone with the illness makes an attempt, at least one attempt. So it's very, very high. Being out of treatment is also a risk factor and not a good way to go. It turns out that motivational interviewing or motivational enhancement therapy, there's different ways that we can describe this, is actually pretty effective in getting people who don't believe they're sick to accept treatment, to accept help, to accept social services, referrals to supervised housing, etc. This is just one study. It's a review in the American Journal of Psychiatry. Interventions to improve medication adherence in schizophrenia. And the authors note, well, first of all, the authors reviewed studies from 1980 through 2000, so 20 years of studies, looking to see what interventions helped get people in treatment and keep them there. They make the obvious point that although antipsychotic medications are often effective, they're not always effective, but often, many people don't take the drugs, so they're not that effective in the real world. That's the first point here. But then they write, although interventions and family therapy programs relying on psychoeducation were common in clinical practice, they were typically ineffective. Now, some of you should be thinking, well, wait a minute. I mean, psychoeducation is one of those so-called evidence-based practices, science-based practices, and a lot of people are promoting that. Are you saying it's ineffective? No. What they're saying, and I agree, is that it's ineffective for that person who doesn't believe they're ill and is not in treatment. And it makes sense, doesn't it? I can teach you all about an illness you don't believe you have, and it's not going to translate into you understanding you have that illness. My brother is exquisitely sensitive at detecting mental illness in other people because he's received a lot of psychoeducation courses. He's very, very good at it. So you can teach somebody about the illness, but if they don't think they have it, they're not going to apply that to themselves. Here's the headline. Motivational techniques were common features of those programs that were successful. Those programs that actually help people get into treatment and stay in treatment were using techniques from motivational interviewing or motivational enhancement therapy. Who here has been trained and met motivational enhancement therapy? Raise your hand. Okay, look around. Nobody raised their hand. This was developed for use with substance abuse patients. People who don't think they have a problem, right? How to engage them in treatment. So if there's a data, why isn't this used more broadly? And the reason for that is that gap between science and practice that I was talking about earlier. There's a lot of research on this, and I didn't have a slide I thought I had, but if anyone's interested, you can email me and I'll send you the citations. Or go to motivationalinterviewing.org, where a lot of people who are in the substance abuse world have compiled research and information on motivational enhancement therapy. I had developed a version of this with Aaron Beck. Most of you have probably heard of Aaron Beck, if you're in the field. Very involved in cognitive therapy, very interested in cognitive therapy and schizophrenia. And we developed a version that I'm going to teach you a little bit about. The version, though, that we developed and got a grant to study was for therapists to learn. What I'm going to talk about after the break is a version that I developed for anybody, whether you're a layperson, with or without the illness, a relative, or a therapist. And there's some data that it's highly effective. The goal is simply this. The goal with this kind of approach is to develop a relationship with that person, where that person feels, and this should sound familiar to you, where that person feels, I listen to him, I respect his point of view, and at some point, actually reluctantly at some point, I share with him my point of view, that yes, I think he would benefit from treatment or services. But that's the main goal here. I'll give you one quick example. Lithium, the first report of lithium's efficacy in the treatment of bipolar disorder in a peer-review journal. Anybody know how many years before it was approved in the U.S.? I don't know about here. How many years before it was approved in the U.S. was the first credible, reliable, valid study, scientific study of lithium being effective for manic depression? How many years do you think it took after that study was published until our FDA approved it? 20 years. 20 years. And that was not because of the FDA. So there's many examples I can give you. So just because you haven't heard about it doesn't mean that there isn't good science behind it. The version of motivational interviewing, if you will, that you're going to hear about is called LEAP, which stands for Listen, Empathize, Agree, and Partner. Now, listening is, I don't know, we all do it, right? We all learn how to do it. I'm not talking about normal listening. I'm talking about active listening. Anybody here know what active listening is? Okay, but what are you doing differently when you're actively listening versus regular listening? I just listened to you. I did not actively listen to you, by the way. What would I have to do that's different if I were actively or reflectively listening? Ask questions. But I asked a question. Okay. What do you mean by get feedback? Verifying the statements. Excellent. Okay. Active or reflective listening has a couple of main differences from everyday listening. And I want you to have an image. You are a reporter. You're a journalist doing a newspaper article. That's the kind of listening. How many of you have ever been interviewed by a journalist? Right? Think about what it's like. They ask you questions, and then what do? Let me see. They put words in your mouth. You're right. I've had better luck, but I walked into that one. What the person usually does is they ask you, okay, so what you're saying is, right? Do I have that right? They check in. They verify that what they're hearing is accurate. Now, I thought it was a useful analogy. Maybe it's not. Think of yourself as a biographer. How's that? A very friendly biographer. The point is that you are actively asking the person, do I understand you correctly? You just said such and such. So that's the first part of it. The second part of it is you do not comment on what was being said. And you do not correct the person if you think something they said is wrong or inaccurate or psychotic. So those are the two main elements of active or reflective listening. Okay? Everybody clear on it? Who'd like to try it with me? I'm going to role play somebody I know. Anyone? Your job is just to actively reflect back what I'm going to tell you. Okay? Excuse me. What's your name? Elaine. Elaine, we're going to pretend you're my therapist. Okay? And I'm going to play somebody who I know with a psychotic disorder. So Elaine, you say you want to help me? You'd like to help me? Okay, then you got to help me with these people upstairs, because every night at 8 o'clock, they are walking across the floor, they're walking across their apartment, they're flushing their toilets. And I know what they're doing. I know what they're doing when they're flushing their toilets. They're talking to all the other people in this apartment complex. I know what they're doing. These are the same people that are trying to kick me out. They're the same people that are trying to kill me. You want to help me? You can help me with that. That's what I said. Well, I didn't say it was bothering me. Let me stop you. Hold on. First thing you did I liked a lot. So it was almost a question. If you're doing this, you're asking a question. Let me see if I got this right. I want to make sure I understood you. You preface. And then you started to talk about what I said. Okay, you know what? Do me a favor. Go to the microphone while we're doing this. I'm sorry. just because I want to make sure other people can hear you. Do it one more time. So I've just said this. Let me go over it again. Elaine, you want to help me, Elaine? Every night at 8 o'clock, these people are going across my ceiling on their floor in their apartment. They're flushing their toilet. And when they flush their toilet, I know what they're doing. They're communicating with all those other people in the apartment complex that are trying to get me kicked out. And these are the same people that have been trying to kill me. You want to help me? You help me with that.
So it sounds like you're hearing people upstairs and it's disturbing you. There's a lot of noise.
Let me stop you there. Good. You made 2 or 3 of the mistakes people make. I appreciate it. What? And you're not off the hook. Stay right there.
Okay.
What was that reflective listening? I didn't say it was disturbing me. Which we're not going to empathy yet. We're only doing the listening and reflecting it back. And in a moment, I think it'll be clear why it's useful. We'll do empathy later. What else did she do or not do? She assumed it was disturbing, but what else? She avoided a lot of stuff, didn't she? I'm not going to repeat what you said because a lot of people didn't hear you, and I want to see if other people avoid it too. But you went to the most common mistake, which is omitting the stuff that makes us feel uncomfortable to talk about. Okay? But the first mistake that you made, which I loved, was that you actually introduced a whole new thing. It had nothing to do with what I said.
Which was what?
They're making a lot of noise that's disturbing me.
Oh, okay. You didn't say that.
I don't care about the noise. What do I care about?
That they're trying. Okay.
Okay.
They're trying to get you kicked out.
They're trying to get me kicked out.
Yeah.
Good. You made mistake number 2, which was
Yeah.
omission. Let me give
Okay.
somebody else a chance. Thank you so much.
Okay.
I really appreciate it. You're very brave. and let me just help you with something. It's scary when someone says, you want to help me with, and remember I said, you want to help me with something, you help me with that. It's scary because we don't know that we know we can't help them with that. Or at least we think we can, right? And so we're not sure what the heck to say. It's not easy. I want someone else to give it a shot who thinks they can maybe, okay, go ahead. Just go real loud then from your seat. Okay. I understand that all these people are plotting and scheming against you and you want me to check things out. 2 things. Your very specific kind of assumption about what I wanted you to do. I didn't say I wanted you to check it out. So you get yourself in trouble. Why go there if you don't have to, right? Like, you really want to have to go check that out? You don't. But it was very, it was very supportive. It was, like Elaine, you're trying to be helpful. But you did that other error. You omitted the scary stuff or the crazy stuff. What did she omit? People who are plotting and scheming against me, what did she omit? These are people who are trying to kill me. Right? Now, does that not seem important to you? Why do you think you didn't say that? You did a beautiful job, but you left out 2 things. They're trying to get me kicked out of the apartment complex. By the way, that's the other thing. And these are the same people that have been trying to kill me. Why do you suppose you didn't just add that? Are you an attorney? I'm teasing you. Right, so are you an attorney? I like your answer. She said, because I used the word killing, she made the assumption that I knew that she knew, so she didn't have to say it. That's not why you didn't say it. Really? I have a theory about why you didn't say it, only because I never said things like that 1,000,000 times talking to patients over the years early on. I avoided talking about things like the alien implant in your brain or the plot of the people in your apartment complex who are trying to kill you. I avoided those things like the plague. I never, ever wanted to talk with someone like Scott about his delusional wife and children and delusional job. If he said to me, Dr. Amador, you want to help me get my life back that you destroyed back in June of 2005, and get me my wife back, and my job back, and my kids back. And I would have to say to him, so you think people are scheming against you? No. I have to say, if I want to engage Scott, what I have to say to him is, so Scott, what you're telling me is you want help getting your wife back and your kids back and your job back. I'm the same guy who told him he didn't have any of those things. But that's how I would say it. If I understand you correctly, let me see if I got you correctly. The only thing you want help with right now is getting your wife and your kids and your job back, right? Okay, that's reflective listening. I don't avoid the stuff that I believe is delusional. We avoid that because we're scared to talk about it. So if I were going to reflectively listen to the guy that I just role-played earlier, I would say, so Javier, what you're telling me is you want help with one thing and one thing only. Every night, people at 8 o'clock are walking across their floor in the apartment above you. They're flushing the toilet. And that is a form of communication. Do I have that right? Yes. And what they're saying, what they're doing is they're communicating with other people who are part of this conspiracy. They're the people that are trying to kill you, the people that are trying to kick you out of your apartment. Yes, that's right. That's reflective or active listening. Who's uncomfortable? And tell us why. You don't know where to go from there. Good. Afraid of saying the wrong thing. That's excellent. What's the wrong? Come on, I know some of you are being polite. Some of you are thinking, wait a minute, I'm not saying anything like that. He's out of his mind. He seemed like a pretty smart guy, and it was kind of fun up until this time, but I'm not with him on this. Because I'm going to do what? Anyone? Feed the monster. What do you mean? Tell me about yourself. Don't tell me about other people, though. What are you afraid of if this were you? You're afraid that you will do what?
Say the wrong thing.
And what would that wrong thing be that you would do? Encourage the trouble that comes with the delusion. Okay. Buy into it. You're afraid you're going to buy into it. You're going to feed the monster. You're going to make things worse. Okay, good. That's helpful. Anybody else? I've never heard feed the monster. I like that. Never heard that one. But that's how I feel. That's how I used to feel. How about worsening the delusion? Anybody worried about that? Yes, raise your hand if you're worried about that. Validating the delusion. I love that. Right? That's a bad thing. Don't validate the delusion. I learned the term, do not collude with the delusion. Do you guys use that term? Do not collude like criminals in the back room, with the delusion. Don't validate it. Why? First of all, well, go ahead. Why? Okay, so you think I'm going to make it worse? Okay. Anyone else? Huh? Put wind in their sails. You don't think I'm feeding the delusion, but what I'm doing is validate. Clearly, I'm validating his experience, no question, which has, I think, value, obvious value, right? Scott will want to talk to somebody who's willing to talk to him about the most important thing going on in his life. The most important thing going on in his life, if this were really happening to him, is that his wife and kids and career were taken away from him. And all the doctors that he will see for the next 10 years, if this were real, aren't going to want to talk very much with him about this. Most doctors, nurses, well-meaning caseworkers, social workers, nobody's really going to want to go there with him because they're afraid they're going to feed the monster. They're afraid they're going to validate the delusion. They're going to collude with the delusion. They're going to make it worse. Who here has made a delusion go away? Who here has talked somebody out of a delusion? Nobody? I haven't. You're not going to talk somebody into a delusion. There's no evidence of, and certainly not in my experience, that by listening and validating someone's experience, you're going to make their delusions any worse. Now, let's be very clear about something. If you're doing this, you're being honest. And being honest means I don't believe the delusion. Right? So when I say, for example, Gloria, what you're telling me is you're not mentally ill, never have been, and that these voices you're hearing are from the alien implant that the aliens, when you were abducted, put in your brain. Is that right? Yes. Okay. Then I can move to empathy. How does that make you feel? Well, how would it make you feel? Well, I would feel scared. You bet I feel scared. I'd feel angry because nobody's listening to me. Yes, that's how I feel. Give you a feel for how you move from reflective listening to empathizing with the feelings. Doing that is not going to make her believe anything new. And doing that is not saying, I believe her, is it? Now, she may make that mistake. Why? She may make that mistake because everybody, whenever they talk to her about the dang implant in her brain, makes a point of doing what? Reality testing. And we do it in a dozen different ways. My favorite is the subtle way that I used to do it. So, Gloria, what you're telling me is that you believe that there's an alien implantation in your brain. How did I do reality testing there? It was subtle. Anybody? You believe. You believe. Scott, so what you're saying is that you believe that Dr. Amador is involved in some kind of conspiracy against you, and that's what led to you losing. That's different than saying, so Scott, if I understand you correctly, here's what happened. Dr. Amador did this thing. You see the difference? From saying you believe or you feel. He may or may not react openly to it, but inside, his heart is sinking. Oh God, another person who thinks this is all in my head. Right? Inside, he's alone again. And that is the importance, and that is the power, frankly, of active listening, of not drawing that line in the sand and saying, me and the rest of the world are on this side and you're on that side because you believe this thing. What else are you afraid of? So we're worried we're going to worsen the delusion. I don't believe we do worsen it. So I've never seen it happen. Again, we do not pretend we believe it. We just make a point of not doing that reality testing. We just make a point of not jumping in and saying, just want to be clear, I don't believe this, which we all do. So let's say we get past that and we have some interactions with the person. So Matt, you're telling me about what's happened upstairs. These people are trying to kill you. Do I have that right? Yes. They're communicating with the toilet? Yes. How do you feel about that? How would you feel? It's terrifying. I'd be terrified. I'd be angry too. What do you think is going to happen if we have those kinds of interactions? There's going to be more feedback. We're going to develop a bond. But what else is going to happen that maybe makes you a little worried? Let's stick with our fear for a minute. Again, you're still believing it reinforces the delusion. But put that into, I don't agree, and that's what we can disagree. But put that into more specifics. What is he going to say that's going to be troublesome? Because I'm reminded of your comment. Where are we going to go with this then? We're going into treacherous waters. And we are. Hold on. 1 second. I'm sorry, Scott. Hold on. We're going to spend all our time talking about the delusion. Oh, yeah? And what's wrong with that? Managed care. Well, okay, let's play this scenario out. Scott, 10 years down the road, has been hospitalized. How many times now has it been? 4 times. He's really been good at evading me and other people who are worried about him. He gets court ordered to meet with you. He has escaped. He has slipped out of the net of the healthcare system. Only been hospitalized 4 times, never taken medication reliably, never been involved, does not, in the healthcare system, does not believe he's mentally ill. He's been homeless. He's ended up in jail a few times because he keeps showing up at Cheryl's house, and she's eventually pressed charges. What are you going to talk with him about? That's going to keep him in your office. Right? That's a billable hour, if you ask me. I would talk to him about his delusions till the sun went down. And I would not call them delusions because I want him to stay in the room with me. Because he's going to be lost. He's going to slip between those cracks and end up in the criminal justice system or perhaps dead or losing years of productive life, right? Because no one will stick with him where he's at. But we're worried about doing it. We're worried we're going to make it worse. But in this scenario, how could we possibly be making it worse? What else are we worried about in terms of the interpersonal space, in terms of what he's going to ask me, what he's going to ask you if you talk to him about what happened? Anybody? He wants me to help him. Help me with this. Help me hire a lawyer to fight this. Help me get on TV and, right. Well, how would you deal with that? Well, you delay. You delay answering as long as possible, whether or not you're going to help. And there's ways to do that I'm going to talk about in just a moment. Why do I want you to delay helping? Because once you get painted into that corner of being asked to do something about what you believe is a delusion, there's a point at which you're going to have to say what? Can't do it, no. And you want to avoid that. And when you do eventually have to say no, you say it in a particular way. You apologize profusely. You say you wish you could do it, but you can't. Okay? But what's the question you're going to get before, help me with this? Yeah, exactly. Do you believe me? Or the flip side of that question, the flip side of the coin, is why are you acting like you believe me? You don't believe me. This is BS. You don't really believe me. Which is really just the same question, do you believe me? All right? You delay answering that question. Why? Because when you answer that question, it's gonna hurt. It's going to hurt your alliance. It's going to hurt that trust. How can you delay answering that question? Huh? Change the subject. Somebody asked me earlier about, what about somebody who's got a lot of memory problems? This is when the memory problems are wonderful. No, I'm not kidding. I mean, I know it sounds funny. But it's sort of, well, it's no different, and pardon the analogy, because I'm not saying that people with schizophrenia as adults are like little kids. But sometimes the attentional difficulties, if the person's not treated especially, can be like an 8-year-old. You can distract them, and they forget what they were focused on a minute ago and upset about. So you can try to distract them. I don't like just changing the topic, because it sounds a little disrespectful. So let's say I ask you, well, do you believe it? Do you believe it then that these people have been trying to kill me? And do you believe me about the fact that I'm not mentally ill? Yeah, but if you leave me away from it, I'm going to feel like you're not listening to me. I believe in distraction, but you need to do something first. You need to listen first. And you need to honor the question that you have been asked. You have been given a tremendous gift when that question comes. This person is saying, you have. You have. My brother, when he would bring himself to ask me again, well, what do you think? That meant he felt that I had been listening to him. And that I had a chance to mend that relationship. What? You could say, I understand. Understand what? I understand what you're telling me. Okay, let's play that out. Okay, yeah, but do you believe it? I mean, do you believe these people are trying to kill me and that I'm not mentally ill? See, you can't get too far with that one. So what do you do? How do you delay? Huh?
You work with the word believe.
So you start doing some reality testing?
No, I'm thinking more of like developing the word believe. Like when you ask me if I believe,
Mm-hmm.
you mean do I understand it? You get up and talk some more about the illusion.
Well, geez, these are highfalutin concepts for me. I just really want to know if you believe me. Understand versus believe. Do you understand and do you believe? I just need help with this. Do you believe that these people are trying to kill me? I'm not mentally ill?
I'm not sure what you mean when you ask me if I believe.
It's simple. Do you think people are trying to kill me? I've been telling you all about them. Yes or no?
You could ask him how strongly he believes.
Hold on, let him try. Yes or no? All right, let me move on, just because we're running low on time. Let me tell you what I would do. You've got to honor the question. Look, if you're doing motivational interviewing correctly, if you're doing LEAP, this form of it, you are never, ever being dishonest. I know that sounds counterintuitive. Like, how do you talk about this stuff without being dishonest? You don't believe the person has an alien implant in their brain. You don't believe the delusions. You don't believe that they are well. You do have to tell them eventually. You have to tell the person eventually if they insist. Absolutely. In fact, remember what I said what the research shows? It's a relationship where the person feels you listen to them, respect their point of view, they trust you, and you're someone who has an opinion that they would benefit from treatment. Remember? That part does have to come in. So here's how you delay giving your opinion. I'm sorry? The problem is it's too much avoidance. Sometimes that will work. But try this on. See if these suggestions make some sense. I promise I'll answer your question. So what do you think? Do you think I'm mentally ill or not? You know what? I promise I'll answer your question, but if it's okay with you, I want to wait and listen to you some more for right now. Is that okay? So I immediately gratify the question. I will answer your question. It's an honest statement. I absolutely will answer it. I hope I won't have to answer it for a week or 2 or 3 or a month so that we can have many interactions where this person feels I respect their point of view. Okay? I'll tell you, but I'd rather keep listening to your views on this because I'm learning a lot about you I didn't know. Can I tell you later? Can I tell you later on? You know, your opinion is the most important opinion in this room, not mine. So I'd like to learn more before I tell you what I think. Is that all right? Scott, if I said, yes, I believe that you believe you have a wife, what would your reaction to that be? It's 10 years later. He's in my office. We've got him in. I believe you believe that you have a wife. Yeah, how would you feel? Search your feelings. Sound like Darth Vader there, sorry. Search your feelings. You know it to be true. Sorry. Like father and son will rule the forensic hospital. No, sorry. You'd feel manipulated that I was jerking him around. Earlier, you talked about getting angry during the break. He was talking about the role play and that he was feeling some of what might be the real feelings you'd have in this circumstance. It's going to hurt, okay? It's going to hurt if you do that. And I'm not being touchy-feely here. I'm trying to keep somebody in a relationship with me who, if I let them walk out that door and they disappear again for another 2, 3, 4 weeks or months, then nothing's happening for them, right? Does this make some sense? What about this last thing? Who disagrees with that? Your opinion is far more important than mine. I'm going to tell you what I think, but before I do, I want you to know something. Your opinion is far more important than mine. Anyone disagree with that? You disagree? Tell me. Uh-huh. Well, I'll tell you, I don't know who I am to him yet. You're right. I am nobody to him. If he says to me, well, you know what, we've been talking this last month, and I think your opinion is actually really important to me, what I will say is thank you, and I'll take that very seriously. Let me explain what I meant. What I meant was I'm going to give you my opinion, but I recognize that you are in the driver's seat. When you walk out this door, you will do what your conscience, what your values, what your life experience tells you to do. And if your life experience tells you your life is in danger and that you're not mentally ill, I understand and I respect your decision to run when they come to get you to put you in the hospital, to fight hard to protect yourself. Your opinion is more important than mine. What do I really think? Let me tell you what I really think. Before I tell you what I think, I want to just say something very quickly. I want to apologize for what I think, because I think it's going to feel hurtful to you. I want you to know that I could be wrong. I don't know everything. I hope we can agree to just disagree about this. I think you'd benefit from some trying this medication and going to this, whatever the issue was. Well, do you think I'm mentally ill? You know, I could be wrong, and I'm really sorry. I wish I felt differently about it, because I know this is really hurtful to you. Yeah, I think you might be. I think you might be. Well, do you or don't you? I do. I guess I'm trying to soften it. It's all about how you do it. It's all about empowering that person, helping them to understand their power. They really are in the driver's seat. Their opinion is far more important than yours or mine. It will drive what they do for for every day for the rest of their life. Does that make sense? So, listening reflectively is playing it back to that person, really wanting to understand their experience without reality testing, without telling them they're wrong, without commenting, empathizing with the feelings that surround those beliefs. Delusions are the most important thing we could talk about, as is the anosognosia. Why do I say that? I'm back to your question earlier. She's talking. She doesn't know that I'm talking to her yet. Watch this. Hi. Sorry. Remember when that happened to you when you were in grade school? It was terrible. I hated it. But I needed you for a minute. I'm sorry. I'm assuming you were so interested you were talking about what was going on. Cool. Okay, good. So here's well, hopefully it was good. Here's the point I was making. Your question is such a good one. Do I just talk about the delusion? And actually, my headline about that is there's nothing more important, probably, that you could be talking about than the delusion or the belief that the person's not ill. And why do I say that? To them, right? It's the thing that usually is driving a wedge between that person and the people in their life. Those beliefs that I'm not sick or the delusions. So they're very, very important things for us to get comfortable talking about without lying and pretending we believe, at the same time giving them room to explore it, to talk about it, and problem solve with it. Now, where are we headed with all this? I purposely spent a lot of time on the reflective listening and empathizing and giving your opinion, and not on the other details, because this is the cornerstone of motivational interviewing. Okay? And let me leave you with a headline about it. But first, a question. How many women in this room have been pregnant? Raise your hand. How many of you got free advice from complete strangers on the street? And why are you all laughing? It was irritating. It was what else? Give me some of the feelings. It was insulting. I like that one. It was insulting. Did you see how quickly everybody read? I mean, I've done this, I don't know, probably a couple hundred times now in other countries, all over the States, and I always get laughter every single time. It's insulting, it's irritating, sometimes it's disrespectful. Why is that? No hesitation. No hesitation, right? You just walk up to you, even touch your belly, give you free advice, right? Why? Why is it so disrespectful? Why is it insulting? Why does it feel bad? Do you follow that advice, by the way? Do you rush home and follow that advice? No. Why? Huh? Why? They assume. Yes, it's disrespectful. Okay. Because you didn't ask. It's that simple. Every one of you who raised your hand and laughed and remembered that experience, I bet every single one of you has at least one woman in your life, a sister, an aunt, a mother, a grandmother, a friend, whose advice you sought when you were pregnant, who had been pregnant before. And you probably listened to that advice. Am I right? Does that make some sense? Almost everyone. Someone's shaking their head. What's the difference between those two situations? In the last situation, in the latter, you asked for the advice. So it didn't feel disrespectful, did it? It didn't feel demeaning. It didn't feel intrusive. And it didn't feel like something you didn't want to listen to. Because you asked. That's why, another reason we're doing this. We want the person to ask us again and again and again. So what do you think I should do? You know what? I'll tell you what I think, but before I do, I want to hear some more. You know what? Your opinion is more important than mine if it's okay with you. You want them to ask you again and again and again and again. Before I finally say to Scott, Scott, can I answer half your question about whether or not it's true versus whether, you need treatment? Let me just take the part that I think is easiest for us to talk about. I think it's worth trying some treatment for 6 months. And let's talk about, your goals. And what are Scott's goals? And that's the other piece of this. where do Scott and I agree? Well, we're never going to agree on him getting his wife back who is delusional. But what we will agree on are things like what? Maybe getting housing again, staying out of the hospital, staying out of jail. These are goals we can work on together, right? And that's the A in the LEAP acronym, which is you look for areas where you can agree and partner. If anybody wants a copy of these slides, you can get them from Hugh. Because I'm going to rush through the last two, so we have a few minutes to talk. But just under agree, we're only discussing the problems that the person sees, not the problems we see. And we look for opportunities to talk about treatment whenever we can. That time that you were thrown in the hospital against your will, did the medication help you with anything? No. Okay. Don't fight about it. If there's an opportunity later on that maybe he's talking about being so scared and anxious about being picked up by the police and he's not sleeping. Hey, when you were taking that medicine in the hospital, did it help you sleep? Oh, yeah, it did. So that's an advantage. I mean, I've worked with people who will take medicine because it helps them with the conspiracy against them. It helps them deal with it. Well, Dr. Amador, then, do you believe there's a conspiracy? You know, what I believe doesn't matter so much. I mean, what matters to me right now, if that's okay with you, is you're stressed out. You're not sleeping. You're terrified every day. Let's see what we can do to help you with all that. I'm just giving you a flavor for how I might turn that question into working on something we could work on together. Let me stop there and we'll take 5 minutes. Well, this is important. Agree to disagree. You know, and we all have heard that, but I think you can't emphasize that enough. I mean, I've said to my brother to this day, I just saw him 2 weeks ago, and he says, and he laughs and says, yeah, you think I'm mentally ill. And I was like, you know what I think doesn't matter, Henry. He says, no, but I know you do, I know. And I said, well, you know, we'll probably always disagree. I hope someday, though, we'll agree. I mean, I hope, you know, you never know. Someday I may come to think of this in a completely different way. I mean, and I might. I don't add. That's doubtful. You know? Why would I want to add that? To do reality testing, to not feed into his, you know. No. I think we're going to stop there. Well, thank you. You guys have been great, and it's been a long afternoon.